Hello, everybody. Good evening. Thank you for joining me again. This is Shaloo Choudhary. I am the occupational therapist talking about the trauma of cancer. And I did a part one last week where we discussed trauma, polytrauma, and then how the impact of trauma is on the physical symptoms of cancer or the after effect, which comes either with the surgery or radiation or just the treatment itself. So I'm going to elaborate on those more and then maybe give some suggestions if somebody's dealing with those physical symptoms, how we can help ourselves to minimize the effect. So thank you again for joining me. So I'm going to start the presentation. Okay, what happened here? Okay. So, I just skipped the disclaimer slide. As I mentioned, this is the continuation of the last week talk where, we talked about the trauma. So, somebody just like a recap of it, just the diagnosis itself, and then to deal with the treatment. And it's not only, the treatment, the physicality of it, like after somebody is going through it on their own body, but how the mind copes up with it. And then the family around it, or our work, we have family, we have children, we have spouses, we have partners, like how those cope up with, we have parents, how they cope up with. So there's a lot of those things which impact, and it not only impact our physical, our emotional symptoms, our behavior, but also has an impact on the physical symptoms, and then how we can help. So just I picked up four of the physical symptoms which I see in my practice, which are cancer related. So we have skin changes after radiation, just called fibrosis. Then we have the swelling component, which is the lymphedema. Then we are dealing with the scars, the surgical scars, and then the loss of flexibility and strength. So they all kind of like, somebody can be dealing with all of them, or somebody can be dealing with one, or somebody can be dealing with an after effect of everything, or one leading to the other. So it depends on it, which stage with it. No, I think that I have to skip a slide. What happened? So, with the stress management, so when the trauma is happening, of course, our brain, our body, we're wired for it. We're wired for it to deal with it. And we all try to deal with it the best of our ability. Whether we internalize the process or externalize it, we all have our coping mechanisms to deal with it. But sometimes it becomes a bit much. And then we have good days, we have bad days. And we have, the body has this inbuilt like fight, flight, or freeze response and rest, digest. You probably have heard it a lot. And these are all related to the wiring in the brain and also the nervous system and how we're managing it. But I think it's very important to recognize that that we're dealing with the stress, and if we need it, we can reach out for the appropriate professionals and mental health counselors or psychiatrists, psychologists to help with. There are also clinicians who are working with a lot of vagus nerve function and then helping to calm things down from that perspective. There's also not only the stress is coming from the disease, but also there's a body image coping. Body image, looking at the skin, looking at the disfigurement, looking at, what is happening with this swelling. Then there's a coping of just a loss. It's a loss. So all those things can sometimes affect the physical symptoms. So we just have to be mindful of those. So I said, about the body image and coping, how we acknowledge ourselves in that situation, and then how we acknowledge how we feel and manage our anxiety levels. And adjustment to the new normal, which is very difficult, especially if somebody's going through a journey of treatment. It's very difficult to find what's my new normal. And, that impacts us. That affects our sleep, that affects our well-being. And then sometimes those feelings can have an impact on the physical aspect of it. So it's, again, very important. I cannot stress enough how important it is to seek mental health professional referrals for ourselves and also for people around us. If somebody's has, parents or spouse or partner or children able to cope up with it, and you're trying to manage yourself and the family around, then, it's important to go through the whole the family counseling and or the counseling for the children. So these resources are available. So wherever somebody's taking the treatment in a big institute, ask for help, ask for social worker referrals, and see what kind of support groups or networks which are available to you in that area. So one of the things which helps with managing these symptoms is the breath work or the diaphragmatic breathing. And in the COVID times, we all heard about, the importance of the breathing exercises or diaphragmatic exercises. Basically, the diaphragm is a dome-like muscles which is under our rib cage, and it works in coordination with our neck muscles, with our pelvic floor muscles, and the diaphragm muscles. And there are also shoulder muscles. There's a lot of muscles which happen around and which help. Now, it's proven, it's research based that diaphragmatic exercises or deep breathing exercises has an impact on stress management, has an impact on anxiety and depression. It helps to cope up with the PTSD kind of symptoms, but it also has a correlation with improving the lymphatic systems, which is our toxin systems, or where it can, the swelling of the arm or leg that can also impact on that. And an impact, when I say impact, is more on a positive impact than a negative impact. So important to learn those kind of diaphragmatic exercises. It also triggers body's relaxation response with physical and mental health. It helps to improve the sleep. So a lot of the exercises are available. There are yoga-based breathing exercises, Pilates has exercises, and there are other personal breathing exercises. We can try that. The other aspect which I really like is the laughter. Our moms used to say, you don't laugh enough, or the laughter is the best medicine. And truly and essentially it is. It is a laughter because it helps to boost the immunity and it helps to improve the mood and reduces the anxiety. It's also an aerobic conditioning exercise, and it's a diaphragmatic breathing exercise. So there's a form of yoga called laughter yoga. Yeah, it is. It is what it is called. There's a physician, Dr. Kataria, who started the whole laughter yoga concept, and it's really wonderful. There are a lot of videos which are available in the social network, in the public domains of YouTube and stuff. And you might want to look into that and then practice that. Now, laughter yoga is one thing, but we can watch a funny movie, read books, maybe talk to the friends. Sometimes just that, and then just like laughing out, it's helpful and helps to reduce the stress. And that also impacts how we cope and then how our physical symptoms will relate to it. So if somebody's dealing with the lymphedema, which is the swelling of it, so there are therapists who are trained, who are lymphedema trained therapists. So make sure that you find the specialist in your area. Now, if somebody's going through surgery or radiation, some of the swelling is surgery radiation related, and it's normal. It's normal, some of those swellings, but they should come down. I tell my patients who have lymphedema or who are at risk of lymphedema, the lymphedema is like your house guest. After Tuesday, it starts stinking. So that's what it is. If it's okay, every day-to-day basis, we all fluctuate with our swelling levels, especially if we're living in an area which is very hot and humid, or we are dehydrated, or we had food which was very high in salt, we fluctuate, in those levels. However, if the lymph nodes are compromised, or you are at a risk of lymphedema, either by a surgery or radiation, or just by the disease process, that fluctuation can stay longer. It means the part can stay swollen for a long time. And if it's not being managed, then it can lead to infections and all the other bad things. So now, how does the stress relate to it? It's just because it contracts the soft tissue, and it's just like we hold our breath a lot, so that also impacts on it. So there's an influence. So make sure that you find a specialist in your area. There are also medical grade compression garments which somebody can wear. My suggestion would be not to go ahead and buy like those over-the-counter stuff. Make sure you go through the therapist and have them help you stabilize the girth size of the arm, leg, or pelvis, and find you the right kind of medical grade garment. It's really important that we get into the right garment, not just any over-the-counter garments. There are also cotton garments, there are special quilted garments, especially if somebody's going through the after effects of radiation and the skin changes. And this is the skin changes. After the radiation or tissues, if the skin is very irritated or it becomes very leather-like, very hard, you can do some oil applications. You can do some non-scented, very low chemical, organic creams. But if there's a sensitivity, just make sure you run by your radiation oncologist to be sure that this is safer and this is not going to interfere during the treatment. So most of the radiation will give you a list of the creams you can apply or not to apply during the treatment. So double check on that. But afterwards, we can do some oil application, vitamin E, or so there's a lot of other oils which you can use, like coconut-based oils are good also. In the long run, the dry brushing is also helpful with reducing the sensory overload. And it's also a detox, detox thing, so it can also help with the flow of the lymphatics. So this we can do it. Sometimes I have noticed that my patients would tell me that they have developed sensitivity to certain kind of clothings or textures. So make sure you identify which clothes are bothersome and to avoid that till the skin gets used to it. Now, it's not always good to just avoid. So you want to retrain your skin with different kind of textures. So rubbing cotton, rubbing an old t-shirt, and a light rubbing, not like rubbing to create like a red mark, but just a light rubbing so that the skin get sensitized to different texture, especially like wooling and, cotton and stuff. But in the beginning, wear organic, natural cotton materials. So that would be helpful. And stiffness as pain. So all these things, whether there's a scar, whether there's a radiation, the skin tightness, whether there's lymphedema, everything adds to stiffness or can result in pain. And so this is like a cycle. So there is a stiffness, which is giving pain, or there's a pain, which is giving stiffness. It's like a chicken and an egg story. But just know that they go in a cycle. So there's a pain, stiffness, it can lead to immobility, like we're not as active, that can lead to fatigue, or there was a fatigue which kind of triggered all those things. But in order to get out of this vicious cycle, we need to move. Walking is a good exercise. You want to make sure that you make a time for regular gentle exercises. And also with the gentle, I'm going to emphasize on pain-guided exercises. We need to respect pain, especially if we're going through the treatment. We need to really respect pain. So if an exercise, so the way I tell my patient is with the exercise guidelines, you want to see, it's like going to the gym, so when we first start the gym, the muscles hurt, but they recover after a few hours, they recover. But if somebody's going through a treatment, that sensibility or that sensitivity is going to be either high or very low, whichever way you want to put at it. So if you're doing an exercise and then the body starts to hurt and it does not recover in a normal, 30 minutes, an hour, it means we've done too much too fast. So we want to slow down to it. So you want to do a pain-guided exercise. None of the exercises should be giving pain. And also here, the important part is we have a lot of information on the social media. We have Dr. Facebook, we have Dr. Google, we have a lot of those things. So be very, very careful if you have not done exercises, and if you're not a person who has done it or not sure, ask a professional, ask a therapist. There are specialized nurses, there are specialized exercise physiologists who work in the cancer rehab. So you need to ask them and then help them devise a personalized program for you, or go to therapy and then have a therapist design an exercise program for you. And these can also help with the cancer-related fatigue. Just a little word on mentioning about cancer-related fatigue. If somebody's going through it, Light exercises is always helpful. Again, your doctor has to clear you for those, but usually light exercises are like is always helpful. The other thing which helps with the fatigue is doing the activity modification, like pacing it out, spacing it out. That is also very helpful. And also know the signs, like which I do and gives me fatigue, kind of like know, like a telltale signs of it, and then adjust the activity and adjust your own self accordingly. So you're able to do that longer versus avoiding it. I just put a slide for some like basic like air yoga exercises. It's just simple exercises. Um, if somebody has some back issue or a neck issue, just make sure that you check with the doctor if you can do this, the forward seated fold. Um, or if you're going through a treatment which is causing some dizziness, lightheadedness, just be very, very careful with these things. Or just run by a physician before you're doing it. So the first one is the seated cat and cow, which is like a stretch and then coming back, hunching, leaning forward, the chest expansion, and engage that the breathing exercises with it, and then do that. Seated pigeon, where you're stretching your hip, and then the spinal twist, which is going sideways just to free up some of the muscles. Because if somebody's not well, they're just like sitting a lot or in the bed. And at the end, I want to put this in, and I said it last time too, that you're not alone in this journey. It's a long journey, but you're not alone. There's a lot of help. We're all fortunately, we're all surrounded by family, friends. We have doctors, we have healthcare professionals. But if something is not jiving well, reach out to the doctors and ask them for referrals, whether you want to see a mental health professional or you want to see a, a therapist, which could be a physical and occupational therapist who specialize in cancer care. Please do so. And then reach out. Do not wait for treatments to finish. Just ask. The early intervention is the best intervention, and do that. And I'm going to end this by saying thank you again. Thank you again for your attention. This is a start of our talks. And I know I covered a lot, and I'm hoping to put this in smaller fragments as we go along. I'll appreciate if you leave some comments or shoot me an email, send me suggestions, so then I can break it down in smaller components and then be able to share my knowledge and also maybe take something from you and then share it with the wider population. Thank you again, and be well.